I welcome you all to CAHO's World Patient Safety Day 2020 event. This is a WHO-initiated global event, and the theme for this year's event is Health Worker Safety, a priority for patient safety. I am Dr. Anuradha Pichmani, Joint Secretary, Hospital CAHO. I shall be the host for today's webinar. To get started right away, it's our pleasure and privilege to welcome Dr. Peter Leckman to deliver his address. Dr. Peter Leckman is the Chief Executive Officer of the International Society for Quality in Healthcare, ISQA. He co-directs the leadership and quality programs at RCPI Dublin. He is also the co-founder and the chairperson of the Pediatric International Patient Safety and Quality Community. He has held important roles at the Institute for Healthcare Improvement and at the Great Ormond Street Hospital, London. Over to you, Dr. Peter Leckman.
Thank you, Anuradha, and thank you all to my friends in India for welcoming me to another session. I've been busy since 8 o'clock this morning on calls, and from one part to another. It's a great privilege to open this conference. Apologies to all that I will only be here for the next 15 minutes, and I have to rush off to give a webinar for ISQA, and then I'll be back again before I go to one with the IOPO. So, World Patient Safety Day is a very busy day for us all, and it's all about celebration and about challenge. Celebration for what we have done so far, but recognizing the challenge that we face going forward. And this year, the big challenge has been not only keeping patients safe, but keeping the healthcare workers safe. The COVID pandemic has really just shown us the need to look after that part of healthcare as well. So what I'm going to do today is just take you through a few issues. For those who don't know who ISQA is, we're an international society. We have many members in India. I see BK Rana is on our call. He's going to speak later. CAHO, a member. We have many links with India. And India is a place of innovation, and we share your vision of wanting to transform the health of people worldwide, and particularly in India now. And how we do it is through knowledge, developing networks, and giving people a voice to share their experience. And I think that's the important part. So what I'm going to do today is actually be a bit challenging, because I think that we have to reflect and ask, why is it that we have the problems now? So with Paul Bertelden and Chris van Hecht, we just published this paper in the reference. It's come out, it's out for review now, so we want comments. And these are the domains of quality and that the Institute of Medicine did 20 years ago: safety, effectiveness, efficiency, timeliness, equity, and person-centered. And what we think is that you have to change it. And as you can see, what has happened in this next move is that person-centered care is not a single domain. We call it pers or kin-centered care. That means it involves not only the person, but involves the whole family and community. It requires transparency surrounding all the domains. You need to add the climate change and eco-friendliness as important. But at the core, right at the core, at the center, is compassion, respect, holistic care, partnership, and co-production. So this is the essentials of patient safety. Now, if you consider we're in 2020 at the second World Patient Safety Day, before the first World Patient Safety Day, 3 reports came out in 2018. One from the WHO, the Global Imperatives for UHC, and soon after that in India, a big UHC initiative started. Then we had the Global Quality Chasm report from the American Academies, 20 years on, almost from the crossing the quality chasm that they did for American healthcare. And then in the sense of the Lancet Global Commission, which some of you might have contributed to. And what the sad thing about it is it said that up to 8 million deaths occurred from unsafe or poor quality care every year in the LMIC. Of course, that is the lower end. much more, because we don't know exactly, let alone what's happening with COVID. So what do we have to do to address this? Well, they came out with these recommendations. If you took those 3 reports, they spoke about the importance of accountability, the importance of UHC, and taking a systems approach. And they're the other ones you can see, the digital health. I think that's going to be the way forward. Who knows? Who knows what we're going to do? And the new technologies, the technologies of telemedicine, for example, that we had to do with COVID. Getting the informal sector, this is very important for India, is how can you get the informal sector involved in high quality care? And then at the bottom, you can see the need for research, culture of learning, and corruption, which is a big problem worldwide in healthcare. Well, people often look to the United States and say, well, it must be safer there. They're the leading country in the world in terms of healthcare, maybe. But these reports come from Tejal Gandhi on transforming concepts, a progress report, the one below by David Bates and Hardeep Singh on 2 decades after to Earth's human, and then this very good book by Kathleen Sutcliffe of reliability fame and Robert Weirs on a report again on American healthcare. And what they're basically saying is it's just not as safe as you should think it should be. This is from David Bates's paper, saying that we know what to do, highly effective interventions, but we're just not doing it. It's variable. So the problem is of implementation. The Gandhi paper actually gave 5 recommendations: education, integration, psychological and physical safety, very important, as you can see this year, transparency, and patients in co-production, which fits very well with our model. So those are the recommendations that are foundational to what we have to do. So we know what to do. There are many national strategies. Now, sorry, I didn't put the Indian one up because I've just seen the Indian national strategy. I'm just going to show you when people often look elsewhere. This is the NHS national strategy. Every country's got national strategies. You've got one. This is the Irish one, where I am at the moment. And this one came out this week. Why I put it up came up because this is the one just come out from the USA. From IHI, they just put this one up. But all these strategies come up with these kind of things. We need to have a culture of safety, leadership, and governance. We need to keep the workforce safe. We need to involve the patients and families, the kin, and we need to have learning systems. So whichever strategy you look at, these are the core functions that we have to do globally. So we know what we need to do. What's more, we even know how to prevent harm. So we know about incident management systems, the theories of reliability, system theory, care bundles, human factors. We know about this. We've also know about the new theories that they call Safety 2, and I've even read one now called Safety 3. So we have many, many theories and methods, but the problem is the one of implementation. And worldwide, I think that is going to be our biggest problem. Is we know why we have to do it. We know what we have to do. We even know how we need to do it. But actually implementing from that is difficult. And I come from a quality improvement background. And even then, I think that we're trying to often improve a broken system. And maybe we need to redesign the system. So I believe the first step for us on Patient Safety Day is to say, how can we think differently? There's a tribute to Albert Einstein. He says you cannot improve something if you continue to do and work in the same way. There is no way we can improve safety unless we redesign and change the way we are working. And that is the key message of today. The first one is this idea of safety culture. How can we develop safety cultures in a system that may be litigious, where there may be lack of trust and not enough resources, or resources are not applied the right way, where our training at medical schools and nursing colleges is not focused on patient safety, is more focused on disease, it's not focused on health. How can we balance the hearts and mind elements? In most things, it's the heart, the dedication of people not to do harm. That's more important because we know what to do. So how can we get this balance really right? So the three key elements that we need to work on, and which you'll be talking about today over time, is the importance of developing the culture of safety, learning, and leadership. We often look at other industries, and there are many other industries that are safe, that were not safe before. So I'm old enough to remember when aircrafts used to crash often. Now they don't. Now it's infrequent. When we do have crashes, they are bad, but they're not like they used to be. And why? Because there's a change of the culture in the airline industry to one of safety and one of learning and leadership. And I could go from industry to industry. Healthcare claims we are very complex and different from other industries. However, we need to make patient safety our business, not only healthcare, delivering health. To do that, this year has been focused. We need to care for both the physical and psychological safety of people. And when I talk about psychological safety, that is the psychological safety of our workforce. It's quite amazing that the work of Amy Edmondson is now very popular. She's been writing for some time, but it's only in the last few years that people have suddenly realized the importance of the psychological safety of the workforce. And we discovered with COVID, that's not enough. We have to make sure there's physical safety as well in order for them to be safe with patients. We need to look at that. For the people, COVID has shown us that care is inequitable in many countries. It's not culturally sensitive, and it's not just. In where I live, in London, the people from ethnic minority groups, i.e. not English, suffered the most. You've got to say why. And there are many reasons. In every country will have this challenge that we have to make sure it's culturally safe for everyone. And then we have to really take a systems approach. And now this is the one I really like because it's based on the theories of Donovan. Systems and processes lead to outcomes. So that is very important. It talks about the importance of understanding how your system works. This is from Pascal Currian, who will be speaking on ISPA tonight on this. She's an engineer and she's looked at healthcare and said, well, if we take a human factors approach and design appropriately, and if we taught clinical teams to do this on a daily basis, to understand how they organize themselves to be safe, who are the people in the team and who are the patients to be seen, what are the needs, what are the tasks that are required, are people skilled to do their tasks, what are the tools and technology that we need. So, for example, in the prescribing, what do you need to prescribe? If you have to protect yourself as the PPE, what are the technology? It could be just pen and paper to keep records. So what is that, and do you have it, and do people know how to use the tools and technology? What's the internal environment? Then you go on to the processes of care. Do you have standardized processes that people agree to and require? Are they reliable? And then you get what are the outcomes? Are we measuring the outcomes? Are they desirable or undesirable? And how do they impact? Now, this is the systems engineering initiative for patient safety. It's been around since 2006, but hasn't hit every clinical team. And we have a program called Situation Awareness for Everyone, which I've run across 50 hospitals in the United Kingdom. Now I've done 20 in Ireland, and I'm about to start another 10 in teaching clinical teams how to take patient safety methodology and theory and put it into their day-to-day practice, so they're constantly analyzing, is their system safe? Are they having reliable processes? And what are their outcomes? So if you want to take home message, is that our challenge is to translate quality improvement and patient safety theory into day-to-day action for clinical teams and to enable them to be safe. Now, coming towards the end, and this is an appeal to you all, this is going to be the decade of patient safety. It's World Patient Safety Day. This document from the WHO was published a few weeks ago for consultation. I was in Geneva, at the start of this consultation process just before COVID. And now they've done a fantastic job to come out with an action plan for 2021 to 2030, the decade of patient safety, which is the WHO decade. And we need your comments on this document by next week. So you've got a week to do it. It's the 28th, they're closing the comments. I'm sure they'll extend it, but if you can, how will this apply to India? What would be the importance? So have a look at it. You go to the WHO website and there you'll find it. So patient safety is a public health issue. It is an issue just like COVID is a public health issue. We have to look at ways of using the exact same methodologies we use in public health to eradicate different conditions. We need to use that in order to be safe. And I'm going to paraphrase Mahatma Gandhi. You must be the change you wish to see in the world, he said, but I'm saying you must be the change you wish to see in patient safety. Unless we start changing the way we think differently, and then act differently, we never will be safe. I want to welcome you to Florence next year in our conference. It was supposed to be right now 2 weeks ago, but it's now in July. I want to welcome you all. Hopefully by then we'll be able to travel. And the idea you can see of the conference theme is emotion, inspiration, and creativity. We need all of those to be safe as we go forward. Thank you very much. And I'm open for questions if there are any, but I'll be back for the panel in an hour's time. Thanks very much.
Thank you, Dr. Peter Laxman, for sharing your global viewpoints on patient safety. We greatly appreciate your taking the time to join us today and hope we'll be able to join us during the panel discussion. Thank you.
Yeah, thanks very much. I'll see you a bit later.
Next, I invite Dr. Vijay Agarwal, President of CAHO, to address the audience.
Good afternoon, ladies and gentlemen. I welcome you all to this virtual conference to observe the Global Patient Safety Day. 15 years back, our country started the journey of promoting quality in healthcare through the NABH mechanism, which is the constituent of the Quality Council of India. And I've had the pleasure and honor to be associated with this journey right from the beginning, from being a part of the, I would say, from leading the first of those hospitals which got the first 5 of the hospitals which were accredited by NABH, and then later on as a co-chair of the accreditation committee, and then now as the president of CAHO to represent on the board of NABH. NABH accreditation has been a great initiative, but even after 15 years, I think its full potential is yet to be realized. Not surprising, considering that USA has 115 years of experience in accreditation and quality promotion, and still in that country alone, medical errors are the 3rd leading cause of death. Then is it surprising that what would be the status in developing countries? We can well imagine the statistics which you can see in developing countries like India. Only saving grace, or I should say shame, is that we do not have the credible data, which is the first step, in fact, to tackle this problem. The decision of WHO to start observing the global day to highlight patient safety, importance of patient safety, I think is the step in the right direction. CAHO is not-for-profit organization which was created in 2013. Kudos to a lot of my founding members. Some of them are here: Dr. Girdhar Gyani, Dr. Alexander Thomas, Dr. Aarti Verma, Dr. Nabeen Patnaik, later on many more people who joined this bandwagon. Now, initially, our idea was to share best practices, create benchmarks, create and develop a lot of training programs. But very soon we realized that in order to make an impact, we must emphasize on patient safety And that accreditation of a healthcare organization is just a beginning of a quality journey of that organization, while most tend to believe as if they have reached the end of the attaining quality. We must emphasize on implementing safe practices to promote patient safety before getting formal accreditation. And for this, we need quality implementers, we need patient safety champions, and not merely consultants who help hospitals to crack the code of getting accreditation. It is for this reason that we decided to complement the role of NABH by creating a pool of quality implementers. We have trained more than 1,500 quality implementers over the last 4 years. We have conducted more than 80 webinars and launched 24 training programs, which are world-class training programs and very affordable. CAHO has earned credibility in a very short span of time. Presence of CEO of ISQA, President of Asian Society for Quality, Chief of the Australian Accreditation System. Their presence here today is a testimony of the credibility that CAHO has attained. And we also have today heads of many associations and organizations with whom we are collaborating to advance the cause of patient safety. We could not have done all this without the involvement of many, many healthcare organizations who are again present today, and quality implementers, patient safety champions, I will say, and all other stakeholders. Our annual events, CAHOCon and CAHO Tech, have become a must-attend event for all the stakeholders. And in fact, we are hoping that you will join us for CAHO Tech very soon from 25th to 29th of September. All 5 days, it is going to be a feast for the people who are interested in understanding that how technology can be the transformative agent for in the healthcare delivery. And for the convenience of the people, this program has been designed for all 5 days in the evenings from 5 p.m. to 7 p.m. And each day we are going to address a theme which will be very, very relevant. Once again, on behalf of my governing committee, I welcome you all to this WHO Global Patient Safety Program. Thank you very much.
Thank you, sir. CAHO continues to drive forward many innovative initiatives under your guidance, and we thank you for your leadership and mentoring. We move on to the next keynote address for the day. I request Dr. Sahidullah, Chairman and Managing Director, KIMS Healthcare Group of Institutions, to kindly introduce and welcome the next speaker.
You have to unmute Dr. Sahidullah.
Can I?
Unmute yourself, sir.
Unmute, sir.
Yes.
Can I?
Yes,
Is it
sir.
okay now? Yeah. Okay.
Yes, sir.
Sorry, some technology issues. Anyway, I am very glad to be part of CAHOCon, and I'm also very honored to welcome our guest, Dr. Karen Lexford. I think she is very familiar to most of us, but for the sake of a lot of attendees who are there, it's a pleasure to introduce her. She is the CEO of Australian Council on Healthcare Standards, ACHSA International. And she's a board chair of Endometriosis Australia, council member of Standards Australia, member of ISCO Accreditation Council, graduate of the Australian Institute of Company Directors. Past positions, she was CEO of Royal Australian College of Dental Surgeons, CEO and Executive Director, Clinical Excellence Commission, and GM of National Breast and Ovarian Cancer Center. So, Dr. Karen Lexford, it's a pleasure to have you with CAHOCON, and we are anxious to listen to your address. Over to you, Dr. Karen Lexford. Thank you.
Karen, you're mute.
Can you hear me now?
Yeah.
Yes, yes,
Thank
we are
you.
able to hear you.
Thank you. I wanted to say thank you very much, Dr. Sahadullah. I really appreciate your introduction, and I wanted to thank everybody for your invitation to speak at this amazing event. And also, I'm very honoured to be one of your speakers, and to acknowledge particularly my colleagues in India and the amazing work that Indian healthcare professionals are doing at the moment. We see your colleagues on the news almost every night, and we're in awe of the things that you are doing. It's an incredibly unusual time for us all. So thank you very much to everybody for all your hard work. And so I wanted to talk to you today on this really special day on the role of accreditation in particular, and some of the things that we're seeing emerging in terms of trends globally, but also some of our experience within Australia. And for those of you, for those of you who may not know ACHS and ACHS International, ACHS is Australia's largest and longest established quality improvement agency and accrediting and assessment group. We have over 1,600 members within Australia, and we're pleased to come from a country that performs very well. I'll tell you a little bit more about that in a minute. We are an independent non-for-profit organisation, and our council has representation from clinicians, from government, from patient groups and consumers, so a very broad-based group. A little bit about the Australian healthcare system. Australians are not very good at beating our own drum, and so often I thought it was interesting to hear Peter's comment about the fact that people do think many other countries such as America have some of the best outcomes, but actually Australia is right up there in terms of our performance in health outcomes, and we're very proud of that. We have very long life expectancy, better than a number of other OECD countries. And our cost effectiveness of our health system is also rated very highly. We spend a lot less on health than many other similar countries and get better outcomes. So you don't tend to hear that very much from us, but that is certainly the evidence. COVID has challenged us all in this year, and in Australia as an island nation, we have also experienced the COVID pandemic. We had an initial spike which happened towards the beginning of the year in March. Indeed, many of us moved to working from home on around the 25th of March. And you can see in the graph, you can see, if my cursor's working, just more recently a second wave, which has largely focused around Victoria, which is the state south of New South Wales, where I'm located in Sydney. But Victoria has been in lockdown now for quite some time. We've had very limited cases within hospitals, and most of the cases are within the community, and aged care has certainly been a challenge for us. We are fortunate that the death rate has been quite low at the moment. So that's where we have been in terms of our experience. I must say that I think our response from our Australian government has been exemplary. And back to Peter's comment about focus on the safety of healthcare workers, that has been a really critical part of safety within Australia, a big focus on the workforce and protecting our healthcare workers, and very clear information from our government. We have an Australian Health Protection Principal Committee, which was set up very early in the pandemic. It directly advises our Prime Minister. I'm pleased to say that our approaches here are very evidence-based. And we are very honoured at ACHS that the chair of our board is a member of that committee, Professor Len Notoris. And it has been working every day, 7 days a week since the beginning of the pandemic, and is really guiding our responses within Australia. So I wanted to shift just to talk a little bit more broadly about some of the trends that we're seeing in safety and quality, and particularly some of the emerging themes, such as not just looking at safety in an episodic way and looking beyond acute care to thinking about the entire patient journey and continuum, and also integrating safety and quality as a whole into those new models of care, rather than safety and quality as an area sitting out on its own. And increasingly a focus on mental health. And I think this has just been accelerated during the COVID pandemic. So the sort of drivers we're seeing, big focus on governance, increasingly public reporting of safety indicators, and moving beyond compliance towards accountability. And that role of accreditation in driving safety and quality is becoming increasingly important. Using funding levers, particularly pay for performance, and IT, as was mentioned earlier, how do we use health technology to make care safer? So new models of care are emerging. Again, COVID has accelerated that. We've certainly seen that in Australia. Telehealth, things that we've been trying to get in place for many years were accelerated in a matter of weeks. New funding models implemented to be able to virtually connect with healthcare professionals. Data analytics, a really big area, and particularly how do we use data analytics to support regulation in the healthcare sector. And population health management has been a big focus, obviously during COVID, and I think will continue to be a focus beyond this pandemic. In assessment, we are seeing a whole range of new technologies starting to emerge, and the ability to use those electronic tools. This, for example, here is a picture of Google Glasses, and we see within COVID, being able to interact with each other from the other side of the world without actually being face to face. Tailoring our approaches to quality, very important, making sure that they work for and are fit for purpose, and looking at cross-sectorial approaches, so integrated care, how do we look across that continuum? So the big areas that we're seeing, and this is true of Australia as well, infection control always has been on the list. The rise of antimicrobial resistance has been a big issue, using particular analytics and diagnostics in safety, patient engagement and partnership, as mentioned by Peter as well, diagnostic error and how we drive that down, and how we actually integrate new technologies into our systems. So there continues to be some discussion about the value of accreditation, and I think it's really coming into its own in this pandemic in terms of services that are really standing out in their performance. This is an evidence review done by the Dweibel Institute just last year, looking at the value of accreditation and really focused on the positive association between accreditation, quality, patient experience and outcomes, and effectiveness of accreditation being determined by the effectiveness and the appropriateness of the standards. So really your accreditation is only as good as the most importantly, it is not a panacea for everything. It's not a standalone solution. It needs to be a part of your bigger approach to quality improvement. Culture and leadership, again, we've heard about that from Peter, positively associated with accreditation. Having that culture of safety and quality is one of the key things on that journey to improvement. I wanted just to share with you some of the data from Australia in terms of what has the implementation of standards and accreditation actually produced in terms of outcomes. And this is some data from the Australian experience in recent years. We have seen a significant decrease in Staphylococcus aureus bacteremia, and very much linked to the implementation of standards. 50% decrease in our national rate of central line infections, which is a huge achievement. And hospitals putting in place antimicrobial stewardship programs has increased from 36% to within a 5-year period, we saw that increase to nearly 100%. Adverse drug reactions and medication history being recorded more effectively, and a big decrease in cardiac arrest rates within hospitals. So we're seeing the benefits now. This is another example, sentinel events, which we know is still a big problem. We have seen gradually decreasing with the introduction of standards within Australia. But we still have a lot of areas for improvement, and these are some of the key standards that we need to have an ongoing focus on. Clinical governance, still room for improvement, how we engage with patients and families, our improvement in infection control, medication safety, and comprehensive care. So this year has been, as I said, a very unusual year. We did pause our assessments internationally, but on the 24th of June, our board approved recommencing our accreditation assessments, and we're doing this very much in a tailored way, working closely with our members so that we can be flexible about this approach. My team early on started to develop new models for assessment, looking at virtual and remote assessment and hybrid models that are really fit for this new world. And so I think where we need to be looking at in the future is, rather than just compliance with standards, which tends to be episodic, we need to be moving to the other end of this diagram and towards an ongoing approach to safety and quality assessment, and really having that driven from within organisations so that we've got a continuous culture of safety and quality, and shifting just from looking at quality to looking at value. And so at ACHS, we're very keen to be combining the quality, the experience and the outcomes, and considering that against cost in terms of healthcare services so that we can get a better understanding of value. And this can only be done in partnership with our patients and families, from whom we learn so much. And so today, being World Patient Safety Day, we need to be recognising that safety is an issue for us all every day, and that our healthcare workers are really the people that we need to be honouring today, and the amazing job that they're doing, particularly during this pandemic. Thank you very much.
Thank you very much, Dr. Karen, for bringing in the Australian perspective on the role of accreditation in promoting patient safety. We invite our next speaker, Professor Dato Dr. Ravindran Jegasodhi, to share his views on the scope of collaboration to promote patient safety in the Asian region. Dr. Ravindran Jegasodhi is the president of the Asian Society of Quality in Healthcare, ASQA. He is a surveyor with ASQA and also an ISQA expert. He is a fellow of the Royal College of the Obstetrics and Gynecology, a fellow of the Academy of the Medicine of Malaysia, fellow in Indian Academy of Medical Sciences. He has published extensively in many journals and served on many technical committees in the Ministry of Health, Malaysia. He has won many awards, which includes the Fellowship of the Academy of Science, Malaysia, and 5 awards from various states and the federal government for the various services in the nation. We are honored to have you today, and over to you, sir.
Can the organizers help me?
Yes, sir.
Yes. Well, anyway, good evening to everyone, and thank you for having me. I'm very honored to attend a conference organized by CAHO, and I know that you have a very wide follower base in India as well as out of India. I just need to get my screen on. I'm just trying to do that. All right. Do I succeed now?
Yes, sir.
All right. So from ASQA, I want to share a different perspective to the previous 2 speakers. You have given the perspectives of the research and theory behind it. And I want to just give you a little bit of perspective from the Asian society, as well as my own perspectives as a clinician with patient safety. My first experience with patient safety was not a very pleasant one. I am an obstetrician, and I remember as a senior trainee handling a pregnant mother with a triplet pregnancy and deciding on an emergency cesarean section for her. And she died because of acid aspiration pneumonia. But that was before the introduction of acid aspiration prophylaxis as a routine for all maternity patients. That was something that was tragic. We learned from it, and we made sure that the whole country followed it, because we lost the patient and the 3 unborn babies. Now, just driving that forward, the Asian Society was created in 2008 after some effort towards creating an Asian group of national bodies, and a total of about 6 nations first started ASQA in 2008. Now, based on the vision and mission of this organization, you would recognize that we actually want to bring together best practices in patient safety so that we can be benchmarked internationally. So our vision is very much in line with that of patient safety. And our mission emphasizes the Asian values of mutual respect and sharing. I think we have a very rich culture in Asia, which dates back many years. And I think we can bring some value to the world if we can inculcate those values into our practices in healthcare and in patient safety. These are the current board members of ASQA We have 11 national bodies which are members, and you can see that Australia is part of it, and we have other big bodies like India, Taiwan, and so on. And we have 2 institutional members of the board, one from Malaysia and one the Australian General Practice Accreditation Group. And we have 2 individual members, of which I am one and Dr. Rana is the other at the moment. So these individual members' board seats are open to anyone who is a member of ASQA. When we look at the milestones that we have gone through from 2008, we started by organizing a first ASQA conference together with the Association of Private Hospitals Malaysia. And then the second conference was with India, with the Federation of Indian Chambers of Commerce and Industry and the Quality Council of India. And then the third conference was in Taiwan with the Joint Commission Taiwan, and so on. And we have had other conferences with Japan and so on, right? And then we have had partnerships with even BMJ conference and the ISQA conference in 2017 and 2018. So we want to build on these collaborations with all our Asian partners to have joint conferences, and I'm very thankful for KHO for having given us this opportunity so that we can collaborate even more beneficially. If you look at our membership through Asia, it is widespread, but I think there are gaps. I think we have got a big gap in China, and we have got some gaps in the Middle East. So these are things that we will work on and try and get them together. And the other that we should work on is the part of Russia that belongs to Asia. I think there's a lot still to be learned from them. And hopefully we do get some collaboration with them, because we do note that some Asian bodies have got collaborative partners with Asian Russia. So coming back to today, our focus is on safe health workers, safe patients, and we need to speak up for health worker safety. And I think that is something which we can all subscribe to. And I want to just now go through what some of the resolutions that we will work on over the next few months. We have sort of moved towards establishing patients for patient safety movements in various national member countries. We have got some vibrant organizations, for example, in Malaysia, for example. And we use that example to propagate patients for patient safety movements in other countries. We have organized the annual World Patient Safety Day celebrations by all national member countries. And we normally come up with a publication that documents what we have all done. We have supported the promotion of the Lucian Leap Patients Fellowship Program through ISQA and the publication of the ASQA Patient Safety Newsletter. So those are just some examples of the collaborations that we have. In Malaysia, they have a Malaysian Patient Safety Council, of which Malaysian Society is an active member. We also contribute some inputs to the Safety Council that introduces policies on a national level. We have focused on reporting near misses. We have moved some way now from mortality. For example, in maternal mortality, of which Malaysia was a leader, we noticed that even though the mortality rate has reduced, 50% of maternal mortalities could have been avoided if something had been done differently by the healthcare workers concerned. Therefore, systems still need to be strengthened and improved. And we are continuing to voice out patient safety issues and working together in patient safety issue in Malaysia. These are some of the photographs from Asian countries, Malaysia and Thailand, for example, and Taiwan, where we celebrated patient safety days. In Taiwan, they have gone on to prevent medical adverse events, advocating respond, react, and recognizing communication. and the promotion of a patient safety week, especially on focusing on fall prevention, medication error reduction, and hand hygiene. Now, these are again efforts which have been done globally, but we have got best practices within Asia, which I think ASQA will share with everyone so that you can try and improve efforts within your own country. In Thailand too, they have adopted a national reporting and learning system while emphasizing patient safety, reducing patient harm and engagement of all stakeholders in the national patient and personal health agenda. In India, I think you have practiced clean care, safe care, and hand hygiene. You have nominated an award, Patient Safety Champions, and I think you have some function again today where you recognize certain champions, and you have engaged stakeholders to strengthen the safety culture at all levels. I think ASQA is particularly impressed with KEHO's efforts in this line, and I think that's the correct way to go forward. I have attended your KEHO conferences and I'm very impressed with the large number of attendees and the quality of the work that you produce. And of course, Australia, we just heard a talk on accreditation. I think you have advocated quality improvement and safety through accreditation in healthcare to advocate patient safety. And again, some photographs from Taiwan and other, Australia, for example, on your patient safety efforts. And I think today we will have some even landmarks being lit up in the various countries. The Twin Towers, for example, the KL Tower, the Great Buddha in Bhutan, the Minar in Pakistan, maybe lit up again. This was in the previous year. But I think to conclude, collaboration in ASQA, I think has to be on the systems approach. I think patient safety will not be able to attain if we do not focus on ensuring that the health systems are not sick. We need to strengthen the health systems. And I think that's the effort that ASQA will make. Through some collaborations, I think with our president, Professor Braithwaite, we have done some health system publications. And I think you will have many Asian examples that you can have and you can read about. The other is, again, to bring some focus that do not only think of infections as causing a problem to our health staff, but also our behavior patterns. Sexual harassment is sometimes under the radar in some health systems. And I think that is something we also can focus on in Asia using our Asian values. And how do we report this without compromising the whistleblowers? There are some good examples to be learned through the various countries. And of course, in health systems, we know that the people who work within the health system have to work as a team. Now, some heads terrorize their staff, but what we learn is what we want is those who educate. I think the educators are those who inspire us. And I think we have to get these good examples from Asia where we would then educate people, instruct people that you need to follow those who educate. And again, our institutions, health institutions in Asia are very good educators. And I think KEHO is one example. And again, when we talk of accreditation, let us go back to the airline industry. And we must not forget that some accidents still happen. And I think the latest, the Boeing MAX 8 story, does give you some learning points with regards to how the self-regulator and also the regulator have failed in somewhat, sometimes in not picking up some of these issues. When a system was redesigned, simulator training was not done, and so on. So I think there are some lessons to be learned. And this is my last slide. Often, this is my 40 years of experience in clinical practice. I have crystallized this into some A to Z of certain competencies and values that everyone must have, whether as an individual or whether as a team. So if you want to learn anything from this presentation, you can take a snapshot of this particular screen and read through this later and see how you can navigate through it. But basically, you need to avoid shortcuts, you need to benchmark, you need to produce checklists, you need to document, you need to practice evidence-based medicine. And we know the 60-30-10 story, that 60% of healthcare is evidence-based, 30% is wasteful care, and 10% is actually care that can harm. And I think we need to slowly change that ratio to a more reasonable ratio so that our patients can remain safe. And we also need to behave better and work together better as a team. So with that, I thank you very much to Dr. Anuradha and your team at KHO for listening to me, and we will take part in some panel questions later. Thank you so much.
Thank you, Dr. Ravindran Jegasuri, for your insightful talk on the subject from a regional perspective. Your presentation indicated the importance of synergy among various stakeholders to enhance the efficiency and amplify the benefits to patients. I'm sure our audience will agree and would join hands with strategic partners in that quest to enhance patient safety. So we heard the global viewpoint on patient safety, followed by a specific country's experience and the perspective from the Asian region. Once again, I thank all the keynote speakers. I now have an announcement. So at the end of the program, we shall be having 5 multiple choice questions, which will be flashed on your screen. We invite you all to participate in the fun quiz event. Participation certificates will be issued to all. We move along to the next part of our program, the panel discussion. So to initiate and moderate the discussion, I invite Mr. Sameer Mehta, Vice President of KAHO and the Vice Chairman of Dr. Mehta's Hospital, Chennai. I also invite Mr. Joy Chakravarti, Chief Operating Officer at PD Hinduja Hospital, Mumbai, to take over and conduct the panel discussion. This panel discussion is on my take on patient safety. I will add my 2 cents on the topic before handing over the mic to our host for this session. As an obstetrician and gynecologist, patient safety includes the various measures we take to improve the maternal and child health to be on track to achieve the United Nations Millennium Development Goals. Minimizing maternal and infant mortality rates can be achieved effectively via implementation of WHO-initiated programs like the State Childbirth Checklist, which I've been working with the WHO now and with the Ariadne Lab. So a lot more needs to be done in this area, and I'm sure collaboration among stakeholders is going to get us there faster than anything else. Thank you, and over to you, Mr. Sameer.
Thanks a lot, Anuradha. So I welcome you from all around the world, and I think it's a glorious day because we're celebrating at the end of the day what truly matters, our customer. At Dr. Mehta's, I mean, this is our 88th year of service, and we have transitioned from, I think, where we started, which is putting customer affection and care at a time in 1933 where my grandparents started at Dr. Mehta's. And we looked at a very different lifetime and reality when we were looking around. Today, if we look at many of the advances, the developments of progress, we see things like in our institutes, we've had over 1 million successful deliveries. But what about the ones that didn't make it? In our institutes, we've had many millions of happy customers. But what about the few that were unhappy? How can we make a difference? And I think that's what most of us have come together in KAHO, in organizations across the world, and in our own institutions to make this a much better reality for improving the lives of our customers and their loved ones. So I think the expectation of our customers are changing. So during our lifetime, we will see value-based medicine enter India. For those of you who have doubts about it, just think about what an average person in the United States must have thought 15 years ago and look at their reality today, where hospitals are paid, where healthcare practitioners are paid only because of the success of the collective outcomes of their institute and where their success is predetermined by it. I think the other thing that we've really observed over this lifetime of change is that this comes down to simple things: ownership of a team, commitment by the people on the ground at every level, strengthening of that team, embracing technology, because if you don't embrace it, honestly, the ones that do will supersede you. And I think there's one thing we've learned in our 88th year as one of the older private healthcare institutions is it's not at times the customer that hurts us, it is ourselves that hurt us. So I think for those of you, keep your customers and their families truly happy. And I think things like benchmarking are critical, sharing our best practices in collective ecosystems are critical. And I will honestly say before we start the panel, I used to be in a former life an election observer, and we used to go and visit countries to make sure that they followed standards of good democracy. That was a pretty hard job because making change in those institutions and countries was very, very difficult. And I have to applaud many of the fellow participants and folks around not only CAHO, but the participants on this call, the assessors and the quality champions in you. You have made much progress in India and across the world in sharing that, because today we share those practices and our standards. And I think that's what we do. Your efforts will make the generations to come stand taller than we were yesterday. And I think with that, let us have a little bit of fun now. Along with my fellow panelists, we've got Joy, who I think him and me are going to have a little bit of fun with some rock star panelists. So I think let me invite a close friend and a dear guide for me myself, Dr. Giridhar Gyani first. I think really doesn't need an introduction, but he's the Director General of the Association of Healthcare Providers of India, AHPI. Dr. Gyani, I think, has introduced many measures, frameworks, standards, education systems, and actually known as the quality man of India. So I think with that, Dr. Gyani, you have played a key role in setting up NABH, in making that a success. Clearly, I think not only India, but the world deeply respects and applauds you through not only awards and publications, but I think your continuous great health and efforts. And I think with you, let me start by welcoming you and by asking you the first of the questions. You have been truly instrumental in promoting patient safety and health in India, first through NABH, through the Quality Council of India, and then beyond now through the healthcare associations. Are you happy with that progress? And where have we really made the progress in hospitals towards that patient safety? Your views, sir.
Can't see Dr. Gyani anywhere.
Gyani ji?
I think you can.
Shall we?
The next, I'll just try to connect with him.
Let's go to the next. Joy, do you want to have some fun?
Yeah. So good evening to all of you. First, I want to congratulate those who are present here for celebrating this World Patient Safety Day. And all of us, you know, this is the second year of this celebration. And I have learned in last 1 hour a lot. And I'm sure as Sam is telling, it is going to be a fun, I think it is a fun learning for me. And I remember my journey in healthcare for last 21 years. When I started, I remember I went to Dr. Gyani. Those days he used to teach ISO and all, no NABH. JCI was not in India, but it was evolving around. And we are speaking about quality, how do you ensure patient satisfaction? Those were very much synonymous in Indian scenario, in Indian context. And from there, the way we have evolved, it is a really, truly a great journey. And in this journey, I see, and I'm not very surprised, but I really appreciate CAHO that in this webinar, we could get, I can see without Facebook, directly in the Zoom call, we have more than 600 participants. That shows the motivation, that shows the change in our mindset, that shows how our Indian healthcare professionals have considered safety as one of the important tools. I work for Hinduja Hospital, which is close to 70 years in existence in Mumbai, one of the iconic institutions, and we have not left any stone unturned to ensure the quality and safety. And we have gone much beyond NABH. We are the first hospital lab to get the CAP accreditation. We are the first hospital to get HACCP for the food safety. And there are many more things what we have embarked into to ensure our founder's vision, quality healthcare for all. So with much introduction, I move on to my first.
Dr. Peter Gyani is there now, so you can move to him, then you can get your.
Okay, so I'll hold on here. So over to Dr. Gyani. We are waiting to hear from you, and nice that you have joined now.
No, I had joined the webinar right from beginning, but maybe I was on the other channel where you was not coming. So I heard everyone right from beginning. Wonderful event, and the two panelists, the two hosts of this session, Samir and Joy. I think I undoubtedly can tell you that the journey of quality, which I actually have been part of it right from beginning, these two gentlemen and their hospitals have been the prime movers, like many others, but these two I will definitely vouch. And I think Vijay has rightly put them as the host of this particular panel. They have taken, because NABH today is because of people like you who actually adopted it, carried it forward, and really made it a big. So I think with that, I am coming back to the question put up by Samir, that am I happy about the journey of quality in our country? I think you have recently seen, I think the Apple, flashed around 15 years of celebration of NABH in a really big style. It really made an impact in most of the WhatsApp groups and across. So 15 years really is a landmark. And Dr. Vijay also made a comment, that if you see the JCI journey from 1951, there is 115 years, and what we have done in 15 years, I think I have a good reason to feel absolutely satisfied. Today, when you have 1,000 hospitals under full accreditation and close to 4,500 hospitals under the certification program, certainly it is not a mean achievement. But I will say one thing, what we have been able to do is positive. One is now quality, NABH is known across all the healthcare organizations. In my first 5 years, we used to have this complaint that many hospitals, many doctors even today do not know. So that gap is completely closed. Number two, all the payers, all insurance company, all the government payers, they are aware and they adopt to the extent possible, not fully, but extent possible, NABH. So these are the two very big positives. Now, what is the gap now? The gap is, I would love to see, I think all of us will love to see that the quality and patient safety one day becomes consumer driven. It is going to take time. Second is, partially we have succeeded, but partially I would like to see it is clinician driven. So the quality should be clinician driven across. So these are the two things which actually NABH and CAHO have to push forward. Third thing, which is synonymous with the clinician driving, that accreditation, because it's supposed to symbolize patient safety. Now when it will happen? When we have clinical indicators openly on the public domain, they are captured and put it in the public domain. They are used by payers, linking with the payment to the patient safety. That is the third thing which actually should happen. It may take some time. So I think with that, I am reasonably happy, satisfied as a person who, has been part of this journey. But now that KAHO has joined now and giving push along with the NABH to the process of quality, I think I am really can say that KAHO has done absolutely wonderful job. They have just come up in very short period of time, and we are very happy to be part of this journey. Thank you very much.
Thank you, Dr. Gyani. And thank you for the kind words for me as well as to Sam. But I can tell you the seed, what you have, put in the soil, that is coming out today in the country. And KAHO is one of those trees which is going to give shelter to many of the aspirants who want to make quality not only a profession, but some sorts of aspiration. So thank you for your words. I move on to the next panelist, Dr. Anand. I'm sure those who are here today, all of you know Dr. Anand, and he is the group head of quality for Manipal Health Enterprise and professor in pulmonary department, also an NABH assessor, and has presented various papers and held training across the globe on quality. I can tell once again, I had the privilege of having Dr. Anand in our hospital when we conducted NABH assessors training in the Western region, and at the same time, several other programs. He's a fantastic trainer, and always people love to have him. And today he is here. So I can tell once again that the way Dr. Gyani started, probably people like Dr. Anand, they have taken over and they're inculcating the same practice. So Dr. Anand, I hope you're here.
Yes, Joy.
Yeah. So Dr. Anand, my question to you is, you have been very actively engaged in training on patient safety. And do you think that after several rounds of this training, retraining, and assessment, the adequate awareness has come? Do you feel that there is a gap? And do you see the knowledge and attitude of health professionals are meeting your expectations as an outcome, what you expected after the training? Over to Dr. Anand.
Thank you, Joy. I think Sam and Joy have set the stage by saying that they're going to have fun and they're going to put us in a position where we can't have fun and have to answer all these tricky questions that Joy and Sam throw at us. Good afternoon to all of you once again. I think, am I happy? Yes. But ye dil mange more. I think if I use the tagline, I think the dil mange more. And why is it that I'm stating that the dil mange more? We have come a long way from the days when I used to always in every training program, a few things are said before even you step into the organization. What is that? There'll be zero medication errors. There'll be zero infections. There'll be zero sentinel events. There'll be zero needle stick injuries. From a stage of that, when we started this journey, to a stage where organizations are willing to state that, yes, we do have a problem. We do have infections. We do have needle stick injuries. And I always say, thank God you are a hospital. So that is the reason I think we have come actually a long way. And this has largely happened because of a change in the mindset, because of the various trainings that are done in terms of how safety is such an important aspect. But at the same time, we're also looking at the tip of the iceberg. There are so many things which just go unreported. In a way, in terms of what are we doing in terms of safety, if I may use the Pareto here, yes, we have addressed the large part of it, which is about the 80 part of it. But there are still so many more areas in patient safety that we have just touched upon. There are so many more vistas that we need to open up. And just to give you an example, Peter touched upon this in his inaugural talk, the culture of patient safety. I think we have just introduced it in the NABH standards, but how many organizations are actually measuring the culture of patient safety? How proactively have we been doing it? And how many people actually understand as to what we actually mean by patient of culture safety? Technology, the COVID era has made us so aware of technology, and we started using technology. Telemedicine is something which everyone knows. What are the new issues, patient safety issues that this has thrown up? Are we trained in these issues? How do we go about? Because at the end of the day, there is still in that consultant, again, taking a cue from what Gyaniji rightly said, the consultant still has that fear. There is this fear of medical legal case. What is going to happen? Am I going to be sued? And this comes a large way in terms of the training not sort of resulting into results. So there is still a gap in terms of what could be the outcomes based on that. So there is still a huge opportunity for us to convert these trainings into tangible outcomes, and more importantly, for research to happen in these areas. Karen said that safety should not be something like an episodic thing. So too, very similar into what happens to our training. It should not be that I have attended the training. Oh, I know so much about patient safety. If I ask you the training effectiveness 3 months or 6 months or maybe 3 years down the line, patient safety, yes, I heard about it. That's something I think which we must all work on and ensure that we sort of strengthen that. And if you ask me one thing, I'll just take 30 seconds more. Why is it that it does not happen? Because I think there are wonderful books written on what is not taught in medical school. Similarly, what is not taught in nursing school, what is not taught in allied. So we can add to this. Unfortunately, we are not trained on many of these aspects during our formative years. And that for me is a big crux of the problem. Thank you, Joy.
Thank you, Dr. Anand. And I have picked up 2 things from your 3 minutes short speech. Ye dil mange more. And I'm sure even after 10 years, if we have the same session, Dr. Anand will come and tell the same thing, because it is a continuous quality initiative and you have to go into that journey. You can't be, satisfied after reaching a particular thing. And like a typical teacher, he told, we need to improve more, we need to do more, we need to get into perfection. I'm sure we'll reach that 6 Sigma level of perfection one day. So thank you, Dr. Anand. With this, I move on to the next panelist, Dr. Siraj Ali Muhammad. He is the professor of microbiology at Manipal University. He is a fellow and global faculty of the Foundation of Advancement of International Medical Education and Research Institute, Philadelphia. He is a recipient of the American Society for Microbiology Early Career Award in 2006, Honorable Mention Award in 2010, UNESCO Award for International Educators, and Outstanding Mentor Award. So I'm very happy to also note that he was awarded the Good Teacher Award 6 times by the Manipal University. He's also the Deputy Director of the Manipal Center for Professional and Personal Development. So I don't think we can get someone better than him to come, educate, teach, and take a session or small brief discussion on what do we think about patient safety. Over to Dr. Siraj.
Thank you, Kaho, Joy, and Sam for inviting me to this panel. Well, I have the unique distinction of talking not only about patient safety, but also promoting the course that we are launching in collaboration with Kaho very soon. Well, much has been learned about how we keep patients safe over the last 2 decades, but little is going to change unless our efforts are improved. And that was very evident in the talks that we heard, and also what Gyaniji mentioned, and Dr. Vijay mentioned.
Can you just focus a little more on the program, what you're going to launch on patient safety today along with Kaho? So advance congratulations to you. And I request you to talk more about the course and its approach.
Yeah, I was coming to that. Yeah, okay. So, however, patients is a medical problem to solve simply because the notion of safety is not simply a technical issue. We would have solved it if it was just a technical issue, but it involves input from a large number of people. Now, these large number of people are embedded in organizational and professional cultures. So it is in this context that we have come up with a certificate course in patient safety that is in the premises of interprofessional collaborations. Now, interprofessional practice is a collaborative practice which occurs when healthcare providers work with people within their own profession, with people outside their profession, and with patients and their families. Now, we did this experiment first in Manipal involving students from health professions. We asked them to basically talk about patient safety. It was first one of its kind, followed by national consultations. And in the national consultation, it was again interesting because we brought in stakeholders from diverse domains. And where is the patient voice? That is also something that we raised through that national consultation. And the outcome was basically, we thought that we should be having patient safety being introduced in an interprofessional context. That is the genesis of this course. Now, you heard people talking about the psychological safety of workforce, which is also important. So I will just sum up by saying interprofessional context, because it basically goes by the 4 competencies. Number 1, the ability to work with other health professionals to maintain a climate of mutual respect and shared values. Number 2, patient safety being discussed in the context of understanding one's own role and other professional health of the people, we can really reduce the errors. Number 3, using a team approach to communicate with patients and their families, and using team approaches, team-based learning, and a number of other learning activities. And above all, perform a variety of team roles to deliver patient-centered care as the 4th core competency. So we have designed in such a way that interprofessional patient safety for enhancing health outcomes involving multiple stakeholders. Thank you, Joy.
Thank you.
Thanks, Dr. Siraj. I think we look forward to seeing many champions that come through your program to, I guess, light the future trees above us in quality. I think moving on to another stalwart in industry, Dr. Bhujang. Clearly, he's been in healthcare management and a recognized medico-legal expert, over 40 years in clinical practice and health administration. I think Dr. Bhujang has led a large tertiary private care hospital for the last 25 plus years and has taught much in health administration and multiple institutions. Author of several books, and I think renowned educator. So I think Dr. Bhujang, I think a lot more serious this time. How do you actually encourage the staff in your hospital and across hospitals to actually report these errors and mistakes around patient care? I mean, everyone's scared. If they report something, they may get fired. They may get looked down on. They may not get a bonus next year. How do you make this come to life? Sir, you're on mute.
Dr. Bhujang. You're on mute, please.
You're on mute, sir. Dr. Bhujang, you're on mute. Please.
You're able to hear?
Yes, sir.
Good afternoon. Thank you very much, Mr. Mehta and Joy. And of course, everybody. In fact, Dr. Giridhar Gyani, there used to be one Dr. Anand from Bombay Management Association and all that thing. In fact, these are the things which actually started almost 25 to 35 years, of course, off and on and off and on. Of course, Dr. Gyani took it in a very serious way, and he's a remarkable achiever in this particular field. You remember Dr. Anand? Once upon a time, So, as far as this medical error reporting, let me tell you my own failure. Not in our hospital, but for last 10 to 15 years, I requested many people, several people, please report whatever you have heard. Okay. Don't tell that you have committed. It is not for anything else at all. Unfortunately, response was so poor. In fact, that is why I requested Dr. Agarwal that we should make another effort toward that. And that's why we are thinking of that convert. Now, to answer your questions, first of all, you already put on 3-4 things. It's really challenging. Why people don't want to report? No, the first thing is that, number 1 is what you said is that reprimand, then action, then legal action, and reputation, especially for the clinicians. They're very much bothered about So all these 4 things actually hold them, and sometimes a sheer indifference. These are the 5 factors that really come into the way of, so how to go about it? So how to go about it is that, first of all, I would suggest that we'll have to motivate and then make all the staff members, healthcare workers, that they are going to be the partners in learning lessons in order to see that the improved care of the patient, and especially in relation to patient safety, they are going to be actually responsible for that. It is definitely not for a punishment, definitely not for all those things. If only we are able to do it by what? By measures that probably whenever you start the institution, when they're inducted in that, we have to give some kind of a training to each one of them about the quality, how to go about as far as the quality in that, this particular thing about the patient safety and reporting the errors. That is something that is absolutely essential across the thing, rather than they all must be prepared that yes, they are also going to the partner in improving the quality of healthcare and improving the patient safety. And you must recognize that. That is something that all of us must really strive to do that. Third thing, what I was thinking, I don't know. In fact, this is the question which I raised even in last seminar. In some of the states in US, it seems that whatever the deliberation that take place should not be taken as an evidence in case of some kind of a litigation, etc., and all that thing. If that actually is brought to in our country too, probably more and more errors will be reported. And I'm not telling that they should not take action, but this particular deliberation should not be part of the evidence that is there. That is something that can really make the whole thing. So it is a big challenge by itself as far as how to make them report. But I have found out that if only we are able to motivate the people in that thing and assure them that that is one part of the story. Second story is that as far as the people, they themselves might not have committed that, but reporting such thing from others, whenever errors have been committed by the others and somebody else who is aware of it, he or she must be encouraged to do that. And the confidentiality must be one who has what we call it a sort of a whistleblower. This kind of a thing in this particular institution, within the institution, of course, is again for a good cause, not for any other thing. So that some kind of a thing, there such people, their confidentiality must be extremely maintained, so that more and more people are encouraged to really tell that who has committed such mistake, what error has taken place. Again, this is something that people will come forward, and then more and more errors are reported. These are some of my thoughts as far as the motivating the people to report the error. I think, Mr. Samir, do you agree with me?
Thank you, Dr. Bhujang. I think to a large extent I do. I think motivating and progressing a culture of, I guess, we already are learning from our mistakes. That's reality. But being able to share that in a psychologically safe manner, which was something that was mentioned right at the start by Peter, something that I think is still a long way to go in most healthcare contexts. I mean, I've seen healthcare in some 18 countries now. So I think in India, we have some ways to go, but I think, Dr. Bhujang, your points on motivation are on the dot. I think with that, let us do a segue. Dr. Sahadullah, another friend of ours and somebody who I think I really look up to for his entrepreneurial zeal, spirit and energy, wonderful energy. This is the founder and chairman of the KIMS Healthcare Group. Sorry, can somebody...
Dr. Siraj, can you mute yourself?
Yeah. And Dr. Sahadullah, can you unmute yourself, I guess, as I wrap this up, which is, I think your experience of building an institution comes with 40 years of outstanding experience across the world, from the Middle East, from the United Kingdom, from the United States, and having built an institution of this progress, not only in India, but also outside India, clearly recipient of many awards, but more importantly, our dear friend. And I think one of the co-hosts of what we will see hopefully next year in KahoCon. I think, Dr. Sahadullah, we'd love to hear from you that how can we actually learn from these mistakes and share them with others, right? Fundamentally learn, because it's one thing to acknowledge a mistake, as Dr. Bhujang said, and to be motivated to report the mistake, but how do we actually learn from it? How do we share it? And how can we then avoid it? Because if you obviously don't learn and improve and share this, that is harder. And how do we learn from each other?
Good afternoon to everyone. It's a pleasure to be with all of you. All of you are doyens in quality and patient safety, and it is an ideal day to discuss this subject. Thank you, Sam. I had the opportunity to work and be the first hospital, one of the first hospitals with the Giridhar Gayani to be accredited in India. And even before, we were accredited by ACHSI. So pretty much, you know, ACHSI, we had a very long relationship. And before that, in Ramco, I was closely involved with the JCHSI, JCI. So, so equality is very dear to us, and your point is very well taken. It's acknowledging and further acknowledging how we go forward with, you know, reaping the reward of acknowledging. In our institution, we have, you know, the main thing is there should be a safety team. And if possible, the safety team, what we do is it should be driven by doctors. You know, what really happens is that we have got 3 layers, you know, the CEOs and the healthcare delivery, the doctors, the clinicians, and then you come to the other level of nursing and other paramedicals in the care delivery. And probably it's a great thing that in the last 20 years I could see in India that the CEO level and the quality people are recognizing very well the patient safety issues. And however, the clinicians still have to be really bought in or brought in to recognize the safety issues. They have a mindset sometime, you know, to refute it or deny it, or that is, you know, error is human, it should happen or it can happen. So I think that attitude is perhaps to be, by a system approach, it should be changed. And so once the incidence reports are being promoted and that is improving all over, and that is the acknowledgement Dr. Bhujang was saying, and so we are acknowledging it. And then it should be analyzed by a team of doctors as is what is the real patient safety error there. Is it something which can be seen and digested, or is it something which is correctable? And so that once that analysis is done, it should be communicated to the clinicians and it should be shared. And what we do in our hospital is through doctors' communication meeting, you know, confidentially, I mean, anonymously we bring it, the cases and discuss. Then of course, morbidity and mortality areas are there. And if there is a mistake by education and a special education to that area or to that individual, it often happens. I would say that in CAHOCON, you know, I think we can take a lot of leadership in this area. And when it comes to a national level, I would say that certainly a standardization is required how to approach these issues. That will give a guidance to the whole, you know, nation and also the accredited hospital. And second, we should have a forum, a repository or whatever you want to call it, and whereby we share these experiences and learn between institution to institution. And lastly, I would say that digitalization and real you know, EMR, the electronic medical records is a very vital role, as a vital role really to make sure that such mistakes are recorded and it is not corrected, nobody will deny it, and then we can really even put in systems by which the quality and the patient safety can be much better handled. That's what I would like to say. And of course, these are areas where we can go on discussing, but these are the main areas I would like to highlight. Thank you, Sam. Thank you for doing such a good job. Yeah. Joy. Yeah, thank you very much.
Thank you, Dr. Sahidullah. Thank you for your, you know, guidance. And you mentioned about that getting best practices and all out. I'm sure under the banner of CAHO, we can accumulate all these best practices, can share and take the healthcare in the next level. Next, we have someone who is little different than many of us. I'm talking about Dr. Ratna Devi. She leads a cross-disease patient alliance in India called Indian Alliance of Patient Groups and work towards policy change, human resources capacity building, and system strengthening. She is the Director, Patient Academy of Innovation and Research, which is, I think, the need of the hour, because we cannot do things for the patient without having them in the center point. And she is the CEO and co-founder of Dakshma Health and Education, an organization that is dedicated to working for access to health and patient education and advocacy. So my question to Dr. Ratna Devi is, what is the role of patients in patient safety in the developed countries, and do you think it is happening adequately in our country? Over to Dr. Ratna Devi.
Thank you, Mr. Joy. I will answer your second question first. No, it is not happening adequately in our country. And I think a lot more needs to be done to get the patient voice where it matters, whether it is reporting adverse events or participating in research and innovative procedures, or being on technical committees, or being seen as equal partners. I don't think patients in India are seen as partners. Forget about being equal. In relation to the first question as to whether patients are reporting adverse events or are part of safety movements in developed countries, again, developed countries are very, very wide in terms of their healthcare delivery systems and in terms of how healthcare systems function, whether it is just the government as a single payment body as in the UK with NICE, or whether it is a mixed system as it is in the United States of America. But either way, we are, one of the things that I also do is being as a chair of the International Alliance of Patient Organizations is also to talk about patient safety globally. And we just had 2 days of Congress, and we had as our keynote speaker, Dr. Soumya Swaminathan, as all of you know, who is the chief scientist. And she raised some very important issues as to why patient safety is not taken seriously in the developing countries. And let me just flip that and say why it is being taken seriously in the developed countries and why patients do get a voice to bring to the policymakers and to the politicians issues that matter to them. So the number one thing she said is strong political leadership. So we had Honorary Jeremy Hunt talking about patient safety today in our Congress. We don't have that kind of leadership in a country like ours. And when you have a political leader that is espousing patient safety, it gives the confidence to the common man to go and, sort of report what concerns them or what troubles them. Then there is a reliance on science and public health. That is something that's totally missing. In developed countries, they develop on, they really, look at evidence, they look at data. And in the morning, Dr. Agrawal alluded to it, saying we have critical data that's missing that allows us to make, good decisions. So I think somewhere we need to invest in systems which can help us to get that good data so that the decision-making ability depends on the process, not on the person. And once we have that, there will be confidence for patients to go and for doctors also and the healthcare professionals to report. The third thing she said was open and transparent communication. Again, something that is not established in developing countries, but very well established in many of the developed countries. And the fourth important thing that she highlighted was citizen involvement. Again, in my introduction, people said that having a patient academy for innovation and research or leading a patient organization is something that's great. But let me tell you, it's a huge struggle in the context of India. What I can achieve in a country, even though it's still considered an LMIC or a developing country, say like Philippines or Thailand, is not possible in India. And if you can go to some of those European countries, if I go as a patient voice, there is an openness to listen to what I have to say. And therefore, there are systems instituted where patients are, expert patients are part of the system. So they're part of the hospital, they're part of the Ministry of the Health, they're part of the quality and accreditation systems, and they have the opportunity to report back.
Hello.
Yeah, and they have the opportunity to report back to the system. And the last but not the least is a no blame culture. So patients, irrespective of what caused the harm, get a reimbursement, and it's not dependent upon who created that harm. I think that's what we need to do if we have to espouse the values that some of the developed countries have instituted in their healthcare systems. Thank you.
Thank you, Dr. Ratna Devi. In fact, the way you have narrated with the Western world, even maybe 7-8 years back, India never thought universal healthcare is going to be an election agenda, and slowly it has become. I'm sure under your leadership soon, these patient rights and the kind of patients to keep in the center stage and deciding the policy is going to happen. And when we have this, probably after 3-4 years, you'll come and present that views also with us. So thank you very much. So I move on to our next panelist, who doesn't require any introduction because most of us or all of us, we need to interact with the organization what he heads. I'm talking about Dr. Atul Mohan Kochar, the CEO of NABH. He is MBBS MD in dermatology from the prestigious Delhi University. He was awarded University Gold Medal for excellence in field of dermatology, venerology, and leprology. He is also a diplomat of National Board and a member of National Academy of Medical Sciences and fellow of American Academy of Dermatology. These are all his academic qualification, but when I was reading about him, a very interesting mission for his life I happened to come across, that his life mission is to provide quality healthcare to the, within inverted comma, last man in the line. And probably that is the reason today NABH stands for, it is reaching to the tier 3 cities to ensure that everybody gets a quality care, everybody has rights to access to quality care, and he is leading that mission today. So I request Dr. Kochar to come and join in here. And my question is very straight, very simple to Dr. Kochar. How do you see the impact of patient safety in India and where it is leading to? Over to Dr. Kochar.
Thank you, Mr. Joy. Thank you, Sam. And I'm really honored and privileged. Thank you, Kaho, for having me here. And it's a great feeling to be in company of such stalwarts. Talking about patient impact, I mean, there's so much has been said already, but the current pandemic has been a great reality test, if I may say that, of the impact of patient safety decisions over the decades. While we have seen changing guidance from day to day, hour to hour happening, new SOPs being thrown at all of us, and it's very clearly been demonstrated that accreditation, whether it is NABH or any other thing, has been a great enabler of adapting to this pandemic and adopting the SOPs. It's been a great enabler of quality practices in this fight. But unfortunately, the pandemic has also shown us a great introspection and shown us that our diverse country with varied geographic and economic challenges has certain realities. So when we talk about that, we agree that we have over the years managed to create islands of excellence, just like Hinduja or Mehta's and hundreds and thousands of more. But as Dr. Vijay said, or as Dr. Gyani sir said, if we are to make a more meaningful impact, enhanced impact, then we have to reach out to people. We have to reach out and connect to more people and connect with them at a basic level, across boundaries, and connect with them about basics of hand hygiene, basics of safe surgery, basics of good communication, basics of medication harm. So basic tenets of patient safety goals, which have been given out for years together. I mean, we have to make them reach that last man in the line, the proverbial last man in the line. So unless our policies are directed there, and while we are talking about patient safety, I must also stress about the theme actually, for all our audience actually, all the health workers' safety.
Yeah, we sent a message, a voice message, audio message. So
Can I request others to mute themselves?
Okay.
Dr. Ashok Dalrapati, can you mute yourself?
No problem. If you want to.
Yeah, continue, Dr. Kochar.
Yeah, so Dil Mange More. So while we must stress upon the basic tenets of the World Patient Safety Goals like hand hygiene and safe surgery, we must not forget our healthcare workers actually. So I mean, you would know today IMA published a list of 382 doctors who perished, and this is just in India. And thousands of frontline warriors, the nursing officers, the ward boys, they are all succumbing to this thing. So if we are to create a meaningful culture of quality, which Dr. Vijay mentioned, everybody mentioned, then as Dr. Shadula also said, we have to learn to collaborate, cooperate, coordinate, share our resources, share the best practices. So unless we share them, so NABH will not hesitate to share the goodwill, all the best practices. We wish to take them to all our quality people, take them to all of them. We will host all those resources on our website. They can visit and access anytime. I mean, that's the only way. We today on Patient Safety Day, I believe we must renew our pledge to stand together, stand by our healthcare workers, stand besides them, our colleagues, and work towards a common goal of patient safety, staff safety, and create a culture of quality. So that's about my desire, wish, and take on today's Patient Safety Day. Thank you so much.
Thank you, Atul Bhai. I still remember the fun we had, latest standards and playing some nice value games.
I still remember, and for all those, I still see about 600 odd people logged in. I must compliment Sam on his ingenuity in creating those value-based card games. I mean, my children loved them. We've played them as a family, and I wish I could photocopy them, or I mean, somehow. But it's a very good tool actually. It's a wonderful tool, and such tools are the basics which will take quality to the masses. So compliments to you. Thank you so much.
I think we'll make one with Kaho and on quality with NABH. I think that is the next thing, so that people learn in fun ways. But wonderful. I think it's a great privilege. Just like we share time and learn from our peers, I think we are going to hold Atul Bhai, the NABH, sharing more best practices, because I think that's what makes us all stronger and makes us sleep better at night. I think I've got another teacher here and another friend, Dr. Rana. Really also doesn't need an introduction, but I have the privilege of doing it. So he's the CEO of QAI, and prior to that, he served as the director of NABH, the Quality Council of India. He has served in ISQA. He currently serves on the board of ISQA, as well as chairs the accreditation committee, or he has chaired. I think he's chaired the Asian Society of Quality, ASQA, and is the chairman of the technical committee currently. And I mean, of course, many experts, I think, what do we say, ISQA expert, card game player like my friends, and more importantly, my teacher and friend. So Dr. Rana, question to you. How can we actually involve the customer, the patient, right? So I've given you a curveball, googly, as the champion of patient safety in the current context, during COVID, during all the stress and the fake news and the politics that goes around. How do we make the customer the champion of their own safety?
Great. Thank you so much, Sam. Thank you very much for a wonderful introduction. And I'm honored to be here. And actually, when you said you and Joy are going to have fun, and Anand come out that they are not having fun, but I was having real fun, because I traveled in last 2 hours. I traveled from Ireland to Australia to Malaysia to India. So it was and within India to several states. So I was really having great fun. So thank you very much for this very important question. And answer is very simple for me, not just by talking, but by doing. We have been just talking about patient safety day, night, every hour, every second, every minute. But what actually we have been doing, okay? And as I always say, and I was talking to Dr. Agwa in the morning itself, and not going beyond, but just last 2 years, I have been to several national and international conferences, particularly on patient safety. And there were a lot of awards for individuals, patient safety champions, a CEO award for patient safety, hospital award for patient safety. But I asked the question to the organizer, where is the patient here? Is there any patient here which we are talking about? No patient representative. There are no patient. There are no patient who has undergone avoidable harm, certainly avoidable harm, which we are talking about. There would be error made, which are not intentional, but certainly avoidable harm, which can be minimized and can be avoided, are the key. So patient engagement, patient voices, patient experiences are very important and fundamental to the patient safety. So first of all, by reaching out to the patients who have suffered or their relative, if they are no more, to talk to them, convince them about the importance of patient safety and their involvement as patient safety champion, how much they can bring to the system, that what contribution they can make to change the system, to make the system better, to make system more safer for patients. Second point, advocating with hospitals. I know there are hundreds of thousands of hospitals now under the accreditation system, but still we are talking about many lacunae, many things to learn. So I think advocating with the hospitals to convince the CEO that please ensure that your strategic plan address patient safety as a strategic priority. It's not just accreditation, but patient safety as a strategic priority. So you allocate funds, you allocate resources and make it happen. The next one might be by establishing a network of patients who have undergone avoidable harms, so that we can have a group of those people, we learn from their experiences and then communicate to the hospitals without, of course, without naming any hospital. And we don't want this culture of patient safety promotion as a blame game or as a complaint handling mechanism. No, it's just getting to know what has happened with the patient, and so that we can convert that into a learning which can be shared by other patients in time to come, as well as the organization who are providing care, the hospital, so that they can certainly look into it. Last but not the least, public awareness. We all said we at one given point of time, we all are patients, you know. So public awareness about importance of engaging with patient in their own safety. When we say patient safety, public might not understand. When we say when you become a patient, what is your expectations? What is you need to do as a champion of patient safety so that you don't get harm in the hospital? You can say to doctor, listen, this is not, I am Dr. Rana, I am not David, and this is not the procedure I am undergoing, if I know those things. So I think these are a couple of points which I thought to share with the audiences to make how we can involve patient. The question is that how we can involve the patient. I would say again, by just doing, not just by talking only. So I think our way forward is how we can engage together to make it a happening and a real thing. Thank you very much. Over to you.
Joy, hopefully you'll unmute yourself so that we can pass the baton and have some fun. I think thanks a lot, Dr. Rana.
Yeah, so thanks a lot, Dr. Rana, and thanks for, being the advocate on behalf of the patients and bringing their interest into the discussion. With this, I move on to the last but not the least, the speaker for this session, Dr. Jaideep Majumdar. He is presently the scientist and program coordinator of INVIS project at ICMR National Institute of Occupational Health, Ahmedabad, with 20 years of research experience in application of ergonomics in workplace and teaching in public health and product design. He has published over 100 research papers. He is also the member of PM Council on National Action Plan for Climate Change on Human Health. So the question what I'm going to ask to Dr. Majumdar is that in terms of the healthcare worker safety, and as today is the theme, that is the theme for the Patient Safety, World Patient Safety Day, that are we doing enough? What do you think?
Yeah, thank you very much for giving me this opportunity. Yes, this is an important question, that whether we are doing enough or not. I would just like to say that, see, that as we all understand that India is a developing country, the status of this workplace safety as well as the worker safety, whether it is in healthcare or any other industry, is also in the developing state in the Indian context. And we are substantially going ahead to develop the entire scenario of workplace safety as well as the worker safety. Yes, definitely, if we consider this patient safety or the healthcare safety in healthcare industry, yes, definitely there are a few factors which needs to be taken care of. And it needs more attention towards increasing the better work life as well as better service to the nation. So which would be number one, the workload. The workload that has been given or being at pace with the either the healthcare direct workers in terms of doctors or the other allied workers who are working in this area. The amount of workload that they have has to be sort of needs to be checked out. It is also about the work schedule. So what is the we should be having a particular work schedule, as we can understand in these few months that we have been facing. It was a very tough schedule for all of us. So we at ICMR can also understand that it was a very difficult phase, going out 24/7 the entire last 5-6 months. So it is definitely again a very difficult period for the people who are directly into healthcare system. So work schedule is an area which needs to be taken care of. Yes, definitely there would be some other factors like the environmental issues which we also cater off. In addition to this, there needs to be a chance of knowledge updation. So those knowledge updation in terms of understanding what they are doing or what is going on in their field in the entire global scenario, that has to be taken care of. Also, definitely there is an importance of the psychosocial stress either at the work life, due to this work life, as well as their personal life. So this combination of personal and work life has to be well maintained. If we look into the psychosocial stress of these healthcare workers who are with us, and definitely to control, to take care of this psychosocial stress, employee assistance program has to be developed. It has to be taken more seriously because it has been there. Now it needs more boosting so that we can help people recognize their problem and they can speak out their problem, so that they can disseminate, yes, this is the problem and what is the solution towards it. Yes, definitely another point which I feel is like recognition of service, which has now been there, but at times it has also been under some challenge. So we need to definitely consider the recognition of the services that they're giving to the nation, to the patients, to the entire society. So if we look into all these factors in totality, so I think the entire scenario of occupational health in the healthcare industry is definitely going to get a boost. Yes, at this institute, the National Institute of Occupational Health, which is the only government institute working in the occupational health in India. So we have been definitely looking into some particular factors, particularly in the healthcare industry, that is the implementation of BOSH, VOHS, Basic Occupational Health Services. So we are trying to find out how this VOHS can be implemented in the healthcare system, particularly to the primary healthcare system in India. In addition, yes, to understand the problem, because it is also very difficult to comprehend the amount of problems they have, we sometimes use the concept of HERA, that is as well as MMERT, which is again an ergonomic tool that helps us to understand, to comprehend the amount of problems that the people are facing, particularly not only we are speaking about this healthcare industry, but every industry as a whole. So we cater all these problems, we try to find out the problems, and accordingly we can go for the solutions. So this in totality, what I feel that occupational health in India is going ahead, and it can be more strengthened, particularly as we have been facing this pandemic for this last 6-7 months. It has been a difficult phase, and we could understood that how important the healthcare industry or the association of the doctors as well as all other people, allied people in this particular field is important to us. So therefore, strengthening on the occupational health scenario would definitely help them to work better, to achieve better, and give more better service to the nation.
Thank you, Dr. Majumdar, and thanks for enlightening all of us. And I think the policy decision has to be taken in a different level to ensure the implementation of all these strategies. And all viewers, all good thing comes to an end. So we learned in last 1 hour, we have gone much beyond the timeline and got a lot of experience and inputs from the eminent industry leader, eminent professionals who are working on patient safety. So thank you for joining here, and I hand over to Dr. Anuradha once again.
Thank you all for the very thoughtful and generous knowledge sharing. I'm sure all of us have benefited from these deliberations and will be implementing various innovative patient safety practices in our settings. So moving on to the next section of our program, we are going to put the spotlight on World Patient Safety Day, how it came about and why. Last year, recognizing patient safety as a global health priority, all the 194 WHO member states endorsed the establishment of World Patient Safety Day. WHO has also recommended the lighting of the monuments and buildings with orange-colored lights to mark the occasion, as we saw in Dr. Ravindran Chirasuri's presentation. Joining us with a special address on WHO and its role in promoting patient safety through World Patient Safety Day is Dr. Chandrakant Lahariya, National Professional Officer at World Health Organization, India. I welcome Dr. Chandrakant Lahariya to present his talk.
Hello.
Yes, sir.
Okay, just I'm getting it navigated. Okay, this is working. Hi, so thank you very much for inviting WHO and me for this important conversation. It's a real pleasure and honor. When we are talking about patient safety and on the World Patient Safety Day, we are talking about in the time and period when the COVID-19 is happening all around. So this is a really important and very valuable conversation. Here, before starting on specific aspects of patient safety, I would like to share that today when we are talking, there are multiple events all across the world going on, deliberating and discussing on patient safety and how we can make health workers and their environment safer in the COVID-19 pandemic times. So thank you very much for taking this initiative, and thanks to Kaho and Dr. Rana and everyone to invite me. I take this opportunity to deliberate and discuss about what has WHO done in the last 2-3 years. And one of the important work, even before World Patient Safety Day by designated in 2019, was WHO and Ministry of Health worked together to identify and study the patient safety content in the various curricula. What was done as part of this work, that a team of experts guided by National Expert Group on Patient Safety looked at how various components of patient safety are covered in a graduate curriculum for medical doctors, MBBS, nursing, medical lab technicians, pharmacists, and auxiliary nurse midwife. And we, as part of this work, studied 24 components in the graduate curriculum. Of these, 9 of the 10 components were from WHO curriculum guide, 8 components were suggested by the expert group, and remaining were identified by for a specific purpose of this study. And we found that patient safety is not included to the extent and on those areas which should be part of the curriculum and content for these category of healthcare staff. So based upon this work, some of the findings will be were released as a report, and a paper is coming soon. And I believe, and at WHO, we believe that this would provide an important guidance on how patient safety can be strengthened across the country. Talking about health worker safety in context of this World Patient Safety Day, I would like to highlight, and I'm going to share my screen for that. Just allow me. I cannot share my screen, it seems. I'm just trying to figure out how to share the screen. Anyway, so I cannot share the screen. So on the specific aspect of patient safety, how we can enhance the safety of health workers and patients, the key would be that we need to have a wider engagement of different stakeholders. So to make the work environment safe for health workers, we need to have some roles assigned to healthcare workers, but we also need to have some responsibilities and roles by policymakers, regulators, parliamentarians, insurance, and legal entities. So they also need to play some role in making work environment safe for healthcare workers. And the third group of stakeholders are healthcare leaders, administrators, and managers at the various facility level, who should equally contributing in this process. Fourth stakeholder, in my opinion, is that academic and research institutions should generate evidence and bring interventions which will make environment safer for healthcare workers. Fifth group of people are patients, families, and caregivers and community. Sixth group is the professional associations, international organizations, and development partners. And the seventh group is patients and civil society organizations. And finally, industry and private sectors. So to make patient safety work and to all this happen, we need to have all the stakeholders coming together. So these are some of the initial thoughts and some of the reflections I would like to bring upon that. There is evidence which has been generated which can be used to make healthcare workers safe in the times of COVID-19, but also we, as all of us, need to work together as a stakeholder, and each one of us need to play a role in improving in that area. And World Patient Safety Day is one good opportunity to take that forward. Thank you very much.
On behalf of CAHO, we take this opportunity to thank WHO for their stewardship. I request all the delegates to stay on, because after the next speaker, we do have various interesting programs which are being launched on this occasion of World Patient Safety Day. And we have the competition prizes announcement too. The next speaker is Dr. Alexander Thomas, founder member and president of Association of Healthcare Providers of India, AHPI, founder member and president of the Association of National Board Accredited Institutions, ANBAI, founder president and patron of CAHO. He is an orthopedician by training, and today he'll be sharing his views on the role of training programs in promoting patient safety. Over to you, sir.
Good afternoon to all of you, and thank you for inviting me to this very interesting and important meeting. All of us know that patient safety is a very broad term: clinical, operations, environment, and equipment. Patient safety, as is evidence today, is a global health priority, and today is World Patient Safety Day, and I think it's an index of the importance that this subject has. The COVID pandemic, as many of our previous speakers have said, have emphasized the fact that patient safety is so very crucial as part of our medical practice. So patient safety is just not another subject for training. I think it is required. Serious thought is required to see how health professionals should integrate patient safety competencies. Now, in India, not all hospitals have good infrastructure. Generally, there's a lack of resources and education. There's a lack of materials, especially there's a shortage of qualified educators. And of course, as always, financial crunches are there. It makes introducing this as a training program more challenging in countries like ours. I was listening to Chandrakant talking about introducing into the curriculum, and I think one of the things that CAHO should do, and we at HPI will be part of this, is to try to introduce this into the undergraduate curriculums. We have had success in introducing a few things into the medical curriculum, like communication, like climate change, environment. So I think we need to make an attempt. It's very important, it's very crucial, it's very much part of medical practice, and we should keep this as a goal as we go forward. But till that time, till we reach that phase where it's introduced, I think programs like this are very, very crucial to sensitize and also give knowledge to our medical colleagues about a very, very important subject. In India, fortunately for us, over the last decade, we have both the founder of NABH and the present CEO. Organizations like NABH, organizations like CAHO and other organizations have started taking the message of patient safety programs and are being supported. I think there's no question now, it's established that focusing on patient safety has reduced adverse effects and how these adverse effects have been managed effectively. And if you look at over the last few years, there has been a gradual transformation in the way that patient safety is viewed. And I'm very happy to say that the government of India has introduced the National Patient Safety Implementation Framework in 2018. And this positions patient safety as a fundamental element of healthcare. So I think it's important that this message is taken forward, and I want to congratulate the CAHO leadership and the team for yet another innovation which is so very important now, so very crucial, and will go a long way in providing quality care to our patients. Thank you once again, and over to you, Anuradha.
Thank you, sir, for sharing your rich experience, expertise, and passion for training, and how it translates to improvements in patient safety. From talks and discussions, we now move on to the launch of CAHO's initiative aimed at improving patient safety. To take this session forward, I invite Dr. Lalit Joseph, Secretary General, CAHO.
Thank you very much, Dr. Anuradha. Very good evening, my dear friends. It's a very proud day for CAHO as we launch 5 programs of immense importance to create the culture of patient safety. We at CAHO believe in synergy and partnership, and the launch of these programs along with our partners is a witness to what partnership can do. The first launch is the Patients for Patient Safety Initiative. This is a collaborative effort between CAHO, Quality and Accreditation Institute, the QAI, Indian Alliance of Patient Groups, IAPG, and Patient Advocacy for Innovation and Research, PAIR. This program aims to incorporate the patient's, family, and community voice into all levels of healthcare through engagement and empowerment. Thank you very much, Dr. B.K. Rana and Dr. Ratna Devi, for the leadership and guidance for this initiative. Dr. Chandrakant Lagaria, sir, with your permission, can we go ahead with the launch video?
Yes, please go ahead.
Thank you, sir. Vaishnavi, can we have the video, please? Thank you. And we have Mrs. Nadira Chaturvedi, a member of the Working Group for Patients for Patient Safety Initiative. And I invite her to give her viewpoints. Over to you, madam.
Thank you, Dr. Lalu, and thank you everybody for allowing us in to this elite group. I really appreciate, and I had no knowledge that there was so much work being done across the globe and in India on the patient's concerns. I have personally been a patient. I have been a caregiver to my husband and to other members of my family. And I have also been involved in patient care in the domains of cancer, to a little extent in mental health and substance abuse. So I speak on behalf of many, although professionally I'm from a management or an entrepreneurial side, but it's really, really encouraging to know that somebody is thinking of the patient. We always feel that the doctors are busy taking care of the disease, but the person is neglected. And the many things involved in the patient's side do not enter the feedback system at all for lack of time, care, concern, or just negligence. I have one request. There's a lot been said already, but two requests. Everything that has been said so far, I think, has been in the safe walls within a hospital. But when the patient has not entered that Haloed portal, what happens to prior and post-care? I mean diagnosis, delayed diagnosis, misdiagnosis in smaller towns, lesser privileged patients who have no knowledge that they have rights even to medical care. I also mean post-care, when the person has left the hospital corridors, the do's are told, but the don'ts are not told. And anything in both these areas could prevent avoidable harm. And it has created harm. I have lots of people who have gone through that. Although we may be just one person in a family, that one person is everything. To a hospital, to a doctor, he may be one of many, many, just a statistic. But to that person's family and to that person, it's only 100 upon 100. So I would certainly be very happy to know that all this is being done. Thank you from all the patients, and anything that we can provide you, we are here to provide if you're listening. And I'm glad somebody's listening. Thank you. Good luck.
Thank you so much for that, madam. We really appreciate you joining us and for that talk. Thanks for that. We are now proud to launch our training program on risk management by our own founder president, Dr. Alexander Thomas. Certified in Risk Management is our first program with the endorsement of ASQA. Thank you very much, ASQA, for endorsing this program. Healthcare risk management is one of the most needed and yet neglected areas in the industry. The current pandemic has highlighted the need for strategic approach to understand and implement risk management strategies. There's an urgent need to build capacity in risk management. It is with this background, CAHO has developed this self-paced online training module. Dr. Alexander Thomas, sir, with your permission, can we go ahead with the launch video?
Certainly, please go ahead.
Thank you, sir. Dr. Alexander Thomas to give his address on the launch.
I'll keep it. Yeah, I'll keep it very brief. I think this is a much needed course, and I think it's going to add great value to the health system in our country. And I want to wish the faculty and the CAHO leadership and all those who utilize this all the best. So maybe continue the journey of improving quality of care that we give our citizens of the country. Thank you very much.
Thank you so much, sir. Our next launch is a milestone, marking our association with MAHE, Manipal Academy of Higher Education, to launch the certificate program on patient safety. This will be a robust program on enhancing patient safety using simulation through interprofessional approach. Dr. Siraj and Dr. Anand, they are here with us who have been instrumental in initiating this program. We launched this program with the blessings of Dr. M.D. Venkatesh, Vice Chancellor of Manipal Academy of Health Education. Can we have the video, please?
I am very happy to note that MAHE FEMA, in collaboration with Consortium of Accredited Healthcare Organization, is launching a certificate course on interprofessional patient safety on the occasion of International Patient Safety Day. Patient safety is a major concern for all healthcare institutions. Measures for patient safety forms one of the critical quality indicators in assessment and accreditation of healthcare institutions by national and international healthcare accrediting organizations. Creation of standard operating procedures and checklists for patient safety and their stringent implementation is critical to ensuring highest quality of patient safety in healthcare institutions. There are a large number of activities centered around the patients, and this also means that there are equal number of instances where patient is potentially at risk. Apart from the standard operating procedures and checklists and the rigorous implementation, another very important aspect is periodic training and continuing reinforcement of all stakeholders on patient safety. Organizing seminars, symposia, workshops, and certification programs are crucial to ensuring highest standards of patient safety. Mock safety drills in hospital also form a vital activity to bring awareness and assess the preparedness to tackle unexpected patient safety issues. MAHE, one of the leading universities in India offering high-quality multidisciplinary education and healthcare, prides itself in its unwavering commitment to delivering highest quality of health profession education, quality healthcare with exceptional patient safety measures, and assesses itself against global benchmarks. I compliment MAHE FEMA and CIHO for recognizing the need for and for conceptualizing this unique certificate course on interprofessional patient safety, and I am very sure that this will immensely benefit healthcare professionals, healthcare administrators across various disciplines, and strengthen the patient safety norms that are being practiced in their respective institutions. I wish the participants and the organizers of this certificate course all the very best. Jai Hind.
Thank you very much for your blessings, sir. Our next launch, Convert, is going to be a game changer. I invite our patron and the father of quality in India, Dr. Giridhar Gyani, to launch this initiative. Convert stands for Confidential National Voluntary Event Reporting Tool. The aim of this exercise is to promote learning from incidents. It is a repository of anonymous events for learning in the form of storyboard. We had a vibrant team of 25 members involved in sharing their ideas under the leadership of Dr. M.I. Sahadullah and Dr. Bhujan, and finally we are going live today. Gyaniji, with your permission, can we go ahead with the launch video, sir?
Go ahead.
Thank you. Thank you. Request Dr. Giridhar Gyani to give his address on the launch.
Okay, I think the name is Convert, means the cultural transformation. And I think you have engaged two stalwarts, Dr. Saratullah and Dr. Bhujang. And Dr. Bhujang in his opening address also mentioned that how difficult it is even for the top administrator like him to get this kind of reporting. So I think this is, I tell you, all the initiatives which you are launching today, in my opinion, this is going to be the most toughest. But knowing CAHO, the way passion is being driving, this organization, I think this will work. And I think the way you are designed, I am sure, with little effort, it will work. And this compendium will be of great help to the healthcare industry. I tell you, we must work for it. Great effort. Thank you very much.
Thank you so much, sir, for those inspiring words. Now, it is time to launch our very own Student Research Mentoring Program. The Student Research Committee, and also welcoming the mentors who have volunteered to help student research. We wish Dr. Shweta Prabhakar, the chair of the committee, and Mrs. Kirti D'Souza, the co-chair of the committee, along with all the committee members, all the very best in taking student research forward. I request Dr. Narendranath sir, with your permission, can we go ahead with the launch video?
To unmute Dr. Narendranath. Sir, unmute.
Oh, sorry. Please proceed, madam.
Thank you, sir. Thank you. Request our own Dr. Narendranath, Joint Secretary, to give his address on the launch. You're muted, sir.
Yeah, thank you, Dr. Lallu, and it's a great privilege to be part of the World Patient Safety Day celebration of year 2020. I want to place on record, it's a great initiative to involve students in the research activity in the patient safety area. It's very much needed as at this hour, especially to foster the culture of research among students in the area of patient safety at the grassroots level. I think we have seen young minds with good guidance will bring great innovation in any area, more so particularly in patient quality and safety. I'm sure the team which you have, the CAHO has formulated will do a great work. And I wish all the Dr. Shweta, Dr. other doctors who are involved in the committee, who was a part of the mentoring program, and also the students who are involved, all the very best in doing this great work. I'm sure there will be a lot of great outcomes. Thank you, one and all.
Thank you so much, sir. And with that, over to you, Dr. Anuradha.
So we'll take it forward, and it's time for the announcement of all the competitions what we have run for this World Patient Safety Day program. And so we'll, I invite Dr. Lalit Joseph, Secretary General CAHO, to talk about the selection methodology for the entries that were submitted. Lalu, over to you.
Yeah, thank you so much. I will take you quickly through the methodology that we adopted for the awards. We launched these awards for the worker safety and workplace safety along with NVIS resource partner ICMR, National Institute of Occupational Health, Ahmedabad. Dr. Mazumdar is representing the organization here, and Global Society of HSE Professionals, GSHP India. Thank you very much, both the organizations, for the wonderful support extended. We invited applications, and we had exactly 100 applications from across the country. We had 93 from within the country and 7 from outside the country, 3 from Dubai, Riyadh, Abu Dhabi, and Sri Lanka. And Kerala with 19 applications topped, and followed by Tamil Nadu with 16 applications. Now, what did we do after we received these 100 applications? We had 3 independent jury, because each hospital submitted about 1,500 word write-up, apart from data on the number of patients treated, the number of healthcare workers who turned positive in COVID areas and in non-COVID areas, along with the number of patients treated and the beds allotted. So we had to go through the 1,500 words to understand the parameters that were common. So we had 3 independent jury who went through 5 random submissions and took about 27 parameters which were common in about 70% of these 5 random submissions that were selected. So these were some of the 27 parameters that were common in 70% of the submissions. So we took these 27 parameters and then went ahead with 6 independent surveyors, dividing the submissions with 100% anonymity, and submitted that to the 6 independent surveyors. They reviewed the interventions made by the hospitals. These surveyors marked yes or no for the relevant parameters, the 27 parameters. For each parameter, only one score, either 0 or yes or no. And also they noted down innovations and new interventions the hospitals had undertaken. So those were penned down independently by the surveyors. Then we had a very vibrant team of jury from the 3 organizations who met for about an hour and a half, deciding on the scoring parameters. So this is the scoring that we assigned. For each of the 27 parameters, 5 points each. Additional interventions and innovations, 15 points. Weightage for COVID beds, about 5 points. Weightage for number of patients treated, highest in that category. We divided the hospitals into 4 categories: small, medium, large, and very large. So within that category, the highest got 15 points. Weightage for number of staff turning positive in COVID areas, the lowest within the category got the highest points. Weightage for number of staff turning positive in non-COVID areas, again, the lowest within that category got the highest points. With that, we arrived at a 200-point total score. 5 for each parameter, 27 into 5, 135. Additional innovations and interventions, about 15 points. Weightage for COVID beds, about 5. Weightage for number of patients treated, about 15. The other 2, 15 each. So we arrived at a 200-point score. And we opened that for the jury. The jury decided under each category that we will choose a winner, a runner-up, and also 2 encouragement awards per category. So we have huge amount of data and wonderful interventions and innovations by the hospitals. Along with our partners ICMR and GSHP, we plan to bring out the compendium of all the new measures and the parameters that hospitals have taken as a white paper for other hospitals to follow. Thank you so much for the submissions, encouraging submissions that hospitals submitted. And over to you, Vijay sir, for the announcement. I think many are waiting for your words now for the announcement. Over to you, Anu.
Yes, thank you, Dr. Lalu, for all the details about the launches and about the selection methodology for the competition. Dr. Lalu is the soul of CAHO and powers up the entire team with her visionary leadership and dynamism. For her colossal contributions to the cause of healthcare quality, a big thank you from CAHO, from all of us. We have now come to the most exciting and eagerly awaited section of today's program, the results of the competition on measures taken by the hospitals towards worker and workplace safety during COVID. To announce the results, I invite Dr. Vijay Agarwal, President CAHO. Over to you, sir.
Thank you, Anuradha, and thank you, Lalu. And it's really my proud privilege to announce the results. So, Vaishnavi, if you can. So, this was a competition for the measures taken by the hospitals, as has been explained. So, in the small category, the runner-up is Dharmagiri St. Joseph Hospital, Kozhikode, Kerala. So really, congratulations. The winner in this category, that is a small hospital, which is less than 100 beds, is Columbia Asia Hospital, Hebbal of Bangalore City, Karnataka. So congratulations to both of them. Now in this category of small size, we have 2 encouragement awards, as has been said. So one is the Wokhard Hospital, Thane, Maharashtra, and another one is the ARMC Aegis Hospital, Perinatalaman, Kerala. I don't think I'm pronouncing it right, but excuse me. Now in 100 to 300 beds in the medium-sized hospitals, the runner-up is Trauma and Emergency Care Center, Bangalore City, Karnataka, while the winner in this category is Esther Sanad Hospital, Riyadh, in Riyadh. Congratulations. And we have, again, encouragement award to the Anand Surgical Hospital Private Limited in Ahmedabad, Gujarat. And another encouragement award is to Kohinoor Hospitals Private Limited, Mumbai, Maharashtra. In the large hospital segment, which is 300 to 600 beds, the runner-up is Fortis Hospital, Mohali, Punjab. And the winner, ladies and gentlemen, is Government Medical College, Omanendurar, Government Estate, Chennai, Tamil Nadu. So that's a real congratulations. And it is kind of an eye-opener to many that the Government Medical College has beaten, I think, a huge number of the private establishments. So great win, Government Medical College, Chennai, Tamil Nadu. The encouragement awards in this category is Bhai Jerbai Wadia Hospital for Children, Mumbai, Maharashtra. And another encouragement award will be Tamam Hospital, Al Ain, Abu Dhabi. So congratulations to these hospitals. Now we come to the very large hospitals. In the very large hospital, the runner-up is Amrita Institute of Medical Sciences, Cochin, Kerala. Congratulations. And the winner is Christian Medical College, Vellore, Tamil Nadu. Congratulations. And we have again 2 encouragement award, one to Ramaya Medical College Hospital, Bangalore, and the other encouragement award goes to Yenupoya Medical College Hospital, Bangalore, Karnataka. So, ladies and gentlemen, thank you and congratulations to all the winners. I think this particular competition had really galvanized the entire, I would say, country, and it has been a great initiative. I think what it has also shown is, I think, I don't know, Lalu, that around I'm told that around 11.5% of the healthcare workers in the COVID areas have succumbed to the during this pandemic, which is, to my mind, a huge number. In spite of such efforts, such good efforts, these kind of figures, they only show one thing, that we have to do more. So more has to be done. And I think this has been a great exercise, which will really galvanize hospitals to think that how do I bring down the mortality and morbidity in my healthcare workers. So thank you very much. And for this one, really speaking, Lalu has been the solid, both brain and the whole hard work behind it. And so congratulations to the whole team of Lalu Joseph. Yeah.
Thank you so much, sir.
Thank you, sir. Congratulations to all the prize winners. The certificate and medal will be handed over to the individual prize winners in person by the governing committee members of CAHO. Congratulations once again to all the participants for their enthusiastic implementation of quality practices in your own hospitals. It's time for me to take leave of you. Thank you all. A reminder once again that you have 5 multiple choice questions which will be flashed on your screen at the end of today's program. We invite you all to participate in this quiz event. Participation certificates will be issued to all. I now invite Dr. Lalu Joseph, Secretary General CAHO, to propose the vote of thanks.
Thank you very much, Dr. Anuradha. On behalf of the President, our dynamic President, Dr. Vijay Agarwal, and the vibrant team of our GC members, all state and zonal representatives, it's a huge group of about 40 of us. It is my proud privilege as Secretary General of CAHO to propose the vote of thanks. CAHO is very proud and humbled to organize this virtual event today, considering the difficult times that the COVID-19 pandemic is inflicting on people all across the globe. I want to begin by thanking our keynote speakers, Dr. Peter Lackman of ISQA, Dr. Karen Luxford of ACHS, Dr. Ravindran Jagasoti of ASQA, and our special address speakers, Dr. Chandrakant Lagaria of WHO and Dr. Alexander Thomas of HPI, for taking the time to join us today and share their expertise. We would also like to thank all the professionals for actively participating in the panel discussion, which was very well hosted by Mr. Samir Mehta and Mr. Joy Chakravarti. We had the privilege of announcing some key patient safety initiatives of CAHO today, and my thanks are due to Dr. Chandrakant Lagaria, Dr. Alexander Thomas, Dr. Venkatesh, Dr. Giridhar Gyani, and Dr. Narendra Nath for their support in launching them. I would also like to register my thanks to all the participants in our healthcare worker safety and workplace safety competition. ICMR NIOH and GSHP very generously partnered with us in this initiative, and I want to thank them for the association. My thanks are also due to the eminent jury who helped CAHO evaluate the submitted entries and choose the toppers in each category. In putting this event together, CAHO has partnered with many like-minded organizations, and I would like to thank them for all their support in the conduct of this program. ICMR NIOH, Quality and Accreditation Institute, a special thanks to Dr. B.K. Rana, Global Society of HSSC Professionals, Dr. Jitubai Patel couldn't join us, WHO, Manipal Academy of Higher Education, Indian Alliance of Patient Groups, Dr. Ratna Devi, and Patient Academy of Innovation and Research. I have to thank the active brains behind all the programs that we launched today. Since I cannot thank them one by one, I have prepared some few slides which I would want to share with you, because it is incomplete without thanking all of them for the efforts that they had put together. Convert, powered by IBAR. Thank you, Bernard and team, for putting this together and for actively putting it up in our website and live today. Dr. Saudullah, Dr. Bhujang, and the entire team that worked with us in making this a reality. Thank you all. Risk management, along with ASQA, powered by IPC Health. Thank you, Samir and team, for the wonderful support provided to us through our online platform. This is the team that put together the risk management program for us. Patients for Patient Safety Initiative, the 4 organizations, and all those working group members of this initiative, thank you very much for the time and efforts that you have put together. Certificate program on patient safety. We will be joining hands very soon. Thank you, Dr. Anand and Siraj, for taking the leadership. CAHO Student Research Mentoring Program, Dr. Shweta Prabhakar, Mrs. Kirti D'Souza, and the entire team along with them, thank you very much for the efforts that you have put in. I really have to thank these young boys and girls. We have a very strong team of women, along with one lone gentleman here, again, company of Dr. Vijay Agarwal. All of them have worked very, very hard. And in the coming days with CAHO Tech also coming up, they have been really working, I should say, 16 hours. Thank you very much, dear friends. And I think they all need a real round of applause. And this has been a wonderful initiative for us. And finally, I wish to thank all the participants and patient safety champions for registering in very large numbers and for the active engagement throughout this afternoon and in keeping this event alive. As a mark of goodwill, we wish to offer registrations to all our participants today for the upcoming CAHO Tech from 25th to 29th at a very special discount of ₹500. So please avail this, and we are very happy to have you all once again between 25th and 29th with yet another wonderful sessions, 5 days of knowledge sharing. Please join us tomorrow for another session on patient safety in ICU, panel discussion for 1 hour starting at 4 p.m. When it comes to safety, a good quote that always comes to my mind is prepare and prevent rather than repair and repent. Thank you once again and hope everyone stays safe in the coming days. Have a great evening. An answer to the questions and your certificates will reach you. Thank you all. Have a great evening.